Welcome to Asake Online. My name is Zenzele Ndebele, and this is the program Surviving COVID, where we talk to COVID survivors, people who have taken care of those who have recovered from COVID, people who have lost relatives, friends, family to COVID, and we want them to share their experiences because it's surprising that almost 2 years after the COVID pandemic, there are some people who still don't believe that there is COVID. There are some people who still don't take the COVID protocols seriously. And there are some people who just think that COVID will not affect them. It's for other people, but not them. This is why you find that there's a lot of hesitance when it comes to vaccinations because people have all sorts of theories. So today in the program, I'll be talking to Lydia Banda, and she'll be sharing with us for the first time. We are having someone who has not really gone through the COVID situation as being a patient, but she has been taking care of someone who had COVID. So we want to find out from her how easy it was, how difficult it was, and how she's taking the whole situation. Lydia, welcome to the program.
Thank you.
Yes, my first question to you would be, I would say condolences for your loss, but the journey for taking care of someone who has COVID, how has it been?
Okay. The journey has been very difficult to process because ungananzelela ukuthi efamilini kuyabe kulabantu ababezitshela ukuthi i-COVID ngiyabanye abantu, especially there are people who still don't believe in COVID endlini khonapho. So people are still not they are still skeptical about testing even up to now. Sesike sabona ku-TV people dying and all that. My experience here has been difficult because I haven't been able to be in touch with the person that I was close to because of COVID in a day.
I was telling you, how did this journey begin? Kwaqala njani ukuze ugcine unakekela umuntu ole-COVID?
Okay. Engingakusho ukuthi njengoba ngishilo eqaliseni ukuthi besingabelieve ubengabelieve yena njengomuntu omdala ukuthi kule COVID. One, uzitshela ukuthi ngumuntu otshona endlini akahamba hambi phandle njengathi. Uzitshela ukuthi thina yithe sizaba le COVID ngoba yithe sihambe etown. So ukuthi plus ubengumuntu akade le i-sugar diabetes and i-BP. So yimkhuhlane akade struggle ngayo for several years. But besingacabangela ukuthi ebengagcina esethethwe i-COVID. So indlela okwenzakale ngayo ukuthi uthe esegula khonapho ese-critical yikho ukuthi kufonelwe i-ambulance. Sizitshela ukuthi they will take care of him with a sense of urgency, sense ukuthi ungabuya nge-ambulance bakuthatha masinya. Wafika laphana esibhedlela, somehow I believe ukuthi kube le bit of some negligence, and we believe some of the family members, they believe ukuthi engabe wathatha i-COVID esesibhedlela.
So awuthi ngikubuyisele emuva la.
Okay.
Uyagula ucritical ubizelwe i-ambulance. Evele ethe suka lapha endlini bebulawa kuyini?
I-sugar diabetes.
Okay.
Kanye le-BP bekungaso COVID esuka endlini. So maye sefika esibhedlela ngale sokufika ahlale maybe amalanga 2-3 days sokuthiwa test i-COVID, kwatholakala ukuthi sele COVID, but ebeke watesta previously watholakala ukuthi akalayo.
Wathi admithwa wayengelayo.
Wayengelayo. So it's a very sensitive issue because even some of the family members, they believe ukuthi i-COVID uyithethe esesibhedlela.
But wouldn't it be possible ukuthi esuka lapha endlini wayengela ama-symptoms atshengisa ukuthi ngabe kuyi-COVID?
The usual symptoms esasilawo esasiwazi esasiwajayele awona lawo ya-hypertension, yawe-BP, le sugar diabetes yakhe ukuthi of course njengomuntu umuntu esekhulile, there were times ukuthi ubesekhohlwa like ukuthatha i-medication ukuzihlaba lani. So in this case kwasokusenzakala ukuthi besizitshela ukuthi as usual ukujayela ukuthi engakukhohlwa ukwenza khokhwana simgijimisela esibhedlela. Nxa efika esibhedlela ufika test abamonitor and then ebesephenduka. But then in this case ukuhamba kwakhe bekungayisikho ukuthi kube i-cause of that, but kutholakala ukuthi ufike watest i-COVID kwathiwa i-COVID. So they tried to monitor that for 6 days and then that was it.
So nge 6 days lezi uhamba khona ngale wena esibhedlela bekunjani?
Okay, I didn't have access to her. Besenza communicator with abantu akade amanesi, the people that were taking care of her over the phone at times. So it was very tense ukuthi ubekwazi ukuthi lesihlobo sakho esiphakathi laphana and you don't have access to her, liphila ngokukhuluma ngefoni, ngumuntu omdala, ngumuntu akade sengane sekhohlwe ezinye izinto. So ngendlela i-medical i-health facilities zethu zeZimbabwe, we know ukuthi somehow wesise-public hospital and it's different from maybe I would say i-private hospital. They would have scaled up their, but in this case it was different. So we thought maybe kube negligence from the hospital. That's what some of the family members believe, ukuthi kube negligence from the hospital.
Yeah, but you see the situation okade kuyo ukuthi umuntu uyagula.
Yes.
You can't see them.
Yeah.
You've been told. So from the time you guys are told ukuthi ule COVID, you have no access to her.
You have no access to her.
Did you ever try maybe like lakhuluma la efonini or?
Yeah, but ngenxa yokuthi ube ngumuntu akade ngathi sevaleka bengasakhulumi kahle, bese kukhulunywa through the nurse okade emnakekela, but people are not satisfied ukuthi maybe if there was a family, what if maybe there was a family member ngabe usurvivile. Yeah.
Wena ngokwakho uzwa njani? What your opinion? What would you think kwakumele kwenzakale?
Okay, mina nxa ngiyiviwa indaba le, of course ukuthi ngabe kwayenziwa fast ukuthi njengomuntu akade ele-terminal illness ngabe wa-testwa early, wa-vaccinatwa early, wahlala lo muntu endlini. But siyakwazi ukuthi abantu abadala nxa especially lo mntwana in the diaspora angazi ukuthi uhamba njani when it comes to their space. They don't want people as long as they receive imali from wherever. So uyabe comfortable and content with maybe umate ozabe emncedisa lokho lalokho instead of a family member. That's how the setup was for my experience. So I feel like for people maybe who are going through what we went through, I would advise them to do it quickly and bengalindi ukuthi kuze ukuthi one thing leads to the other in terms of yena le eyenzakele njengeyami.
You talk about vaccination.
Yes.
Did you try to talk to umuntu omdala
Yes.
ukuthi hamba ndiyehla?
Ukukhuluma ngakho sazama ukumtshela ukuthi ugogo kumele ayehlaba, but ngenxa yokuthi kulama ongama-beliefs khonokho ukuthi COVID is vaccine is satanic. It will lead to other things. It will lead to other diseases. It was very difficult to convince her ukuthi sithi ahlabe. There are a lot of people even of my age who are still skeptical about getting vaccinated. So I would say I would encourage everyone who's listening to this video, who's watching this video, to go out there and get vaccinated. Yes.
Well, how was your experience?
It took me a lot as well. I had to research more about it, although I still have a number of questions that are not answered. Okay, now that I am vaccinated, then what? I got sick as well, but not because of COVID. I would say I had a number of symptoms. I went and got tested, but then it came out negative. But then I had that thing, I'm vaccinated, so I'm safe. But it's during everything I'm hearing people are dying even though they were vaccinated. So there are a lot of questions that are not answered when it comes to vaccination.
Yeah, but I think people need to be aware that the vaccination does not stop you from having COVID, but it reduces, seriousness. So this is why you're saying there are less people who are vaccinated who end up in hospital, and there are fewer people who are vaccinated who die. But yes, people who have COVID. who have been vaccinated might die in the process for various reasons. I hope one day I'll invite a doctor who will try and explain to abantu ukuthi being vaccinated is not necessarily, a shield against the, COVID. It reduces my chances of maybe hospitalization, but it might end up being hospitalized. But you're better off vaccinated than not being vaccinated. Yeah. But what is said is there are people of your age who still don't believe with the COVID. Or who don't believe in vaccination.
Right. Yeah. I feel like maybe the medical fraternity is not doing enough in terms of explaining why people should get vaccinated. That was not explained to me. Why should I get vaccinated? Does it mean I am now immune from the virus, or like what you have just explained? So I feel like there is a gap. Okay, now that you have been vaccinated, that is not explained to people. We encourage you, go out and get vaccinated. For what? People are not told to okay, you are getting vaccinated because they are trying to reduce your chances of attack kakhulu yi-COVID ukuthi la immune yakho can fight ngamandla. Yeah. So in this case I feel like there is a gap khona. And the reason why I said people of my age, there are a number of people who still don't believe. I don't have a child myself, but as I told you, there is someone who thinks once they get vaccinated, that might affect their fertility once they want to conceive, or there are people who still believe in that. And then there are people with religious beliefs this is satanic and all that, people of my age. And for you to convince someone who is woke like me, it takes a lot. But now I want to say because of my cases and because of my deaths, SSCS our witness.
But you find that people are saying young people are the ones who most of the times, like you said earlier, but the young people are the ones who go out a lot.
Yes.
I was talking to a friend of mine. I'm told I'm going to put my way in power. What I'm a regular customer. So to me, excitement they would get in a regular customer to the extent to vule power and not see the dangers. Why is it that young people, still don't take the issue of COVID seriously?
I think it goes back to the issue of livelihood and the lifestyle that we're used to. So it really takes a lot for someone to adjust and say, okay, the mask and I will social distance, I will sanitize, and I will still go out and mingle and do whatsoever. Bayakhipha ama-mask beshayisa afana.
Then
so kuqoqa music sikhala sokumnandi.
And omunye sebhema ugwayi ngale, all those kind of things.
Yeah, thina njengama-youth, I feel like we are the ones who are actually perpetrating the spread of this thing. We contribute to that as well. Because abadala, of course, like mine, she was always at home. You will find ukuthi umzukulu would go out, maybe wayiphathelwa ngumzulu yena lo, nobody knows. So we need to be very cautious with our actions as young people. We need to be responsible. Singabi selfish ukuthi I'll take care of me as long mina ngi-right. There are people that you are living with, there are people that you interact with. So we really need to be responsible when it comes to that.
Yeah, this experience that you have gone through, how has it affected you as a person?
As a person, seeing something on the television is different than to you experiencing it or going through it. It's a different story, because ngangizitshela ukuthi COVID, of course, maybe we don't fly, like we don't fly mbijana sesise-UK kumbe just use ozukhona laba abakhona sesisendlini sokunjani. I-COVID ayikafiki kithi. Ama-hotspot, we receive almost daily updates about ama-cases, and ama-hotspots angisho kule ndawo nkulumani ngaphi uyiwange whatsoever. Thina we know that kuyafana nale AIDS, indlela i-AIDS eyabuya ngakhona. People thought ukuthi as long as mina ngingayenzi so, but uzathola ukuthi as long as you were sexually active, no, even if wena wawuzigcinile, even if you were faithful, uzathola ukuthi omunye wakho was not being faithful, and then that's how most of the people got sick. Uyabo sitshela ukuthi wena right. Same applies to COVID. I feel like sizitshela ukuthi ilabantu babo for now isa affect abantu babo, but mina sengibonile ukuthi this thing is real and somehow I feel like it's here to stay. Khona kuyani ukuthi usadila sokule new variant, sokule Delta. When you are vaccinated, and I'm not vaccinated. She is vaccinated, that one is not vaccinated. Obviously, there is a margin for a new variant within that space. So
yeah, and maybe lastly, what is your message to other young people?
My message to young people is people need to grow up. People need to be socially responsible. People need to take their space in terms of liquidating, in terms of disseminating the information of vaccine. People need to go out and get vaccinated. Singaphoma ukuhlala nje sizitshela ukuthi into le asoyethu.
Yeah, maybe there's before we close, there's something that I really need to find out. I mean, your grandmother passes away. This comes COVID. So how does the burial arrangements, or how did that go on? I mean, maybe something that you can share your experience with that.
Okay, Ukoko is someone who was a pillar of the family, someone who was bringing even the ones in the diaspora together. Her passing has been a major loss to us because bekunzima ukuthi sihlangane sesiphila ngamafoni. The arrangement, we did the whole thing over Zoom. It was somehow I feel like it will contribute to ukungabambani kwe-family, because she was the only reason why someone would fly all the way from UK ethi angifuna ukuyabona umama. So now that ikasekho and people didn't have the chance to say maybe their last words, to see her, to do body viewing and things like that, it has been a challenge. I feel it's difficult for everyone to deal with or to process.
Yeah, because what you are saying is important in the fact that usually we will say ayisimhambise esibhedlela egula.
Yes.
Then ngesikhathi egula umuntu uyadeteriorate.
Yes.
As family, we don't want to accept publicly ukuthi hayi kubi. But siyabe sibona kuma visits ukuthi there is no point of return here. It's not, it doesn't get better. But sometimes you have to totally hope usithi hayi sekungcono. So umuntu umchile wena ungene kwambulance uthiwa hayi ule diabetes wamchiya esibhedlela. And everything, how over 6 days, you don't know whether we are deteriorate or maybe ufuna ukulayela something, as Africans we believe ukuthi umuntu kafe ngakhulumanga. Maybe there's something that they want to say, maybe ule million kade vele diaspora kade ngaphansi komqamelo, and all those kind of things. So all these issues, so it then comes to you as news. Umuntu lo akasekho. You don't even see them to really say, okay, say feel for sure. How does that affect your side?
I come from a very traditional family. We believe in, people saying their last words. We believe in them giving signs. So, okay, a city so, which means lapana vele besevalelisa, but nobody had that chance. So, as an individual, I feel like, if kungayenzakala maybe kuma families maybe 2, 3, 4 same thing yenzakala, there will be a lot of breakages within family setups, because it was the reason why people would come together, would make a conference call and would connect with everyone or ngekhoyo. But then in this case I feel like there is a lot that she left pending from a traditional perspective, ukuthi maybe ngabe ugulile, of course ugula begula and behamba esibhedlela nxa kuthiwa soku-critical, afike asile bengumuntu ade simbhilivele ukuthi ubeqinile. But then in this case sesizwa sokuthiwa uphelile because of i-COVID. So olalo ugogo bele-COVID sezoshonela esibhedlela. It's very difficult like to deal with.
But when as a person, have you accepted it, or you just think, no, it's not true?
Personally, I'll say I have accepted that because considering her age and the age group that is being that is on brackets, which okay, age group enje is vulnerable to this pandemic. Ugogo besekhulile. I have accepted it. Okay, maybe our health institution might have failed her at some point due to maybe pressure labo abalayo in taking care of other patients. Maybe if it was a few years back, kungasikho COVID, they were going to give her much attention that she needed, and maybe she was going to survive. But then in this case, yeah, it is what it is.
Okay, I would like to thank you for taking this time to share your experiences with us. And I would say we really, as a people, as a country, as the world, we are chartering new territory where, you don't have that opportunity to say, ngiyavalelisa isihlobo sami, the family member, we go to funeral and people speak good of the person, sifaka amaluba sidele ukuthi umuntu uhambile, but burials are hurried. 5-10 people do the burial, and abanye lizawubona amapikitsha and all those kind of things, and that really affects many families, and I believe it will have long-term effects at personal level. Ngoba njengabantu abamnyama silenkolo esilazo, like I said, abantu babhilive ukuthi umuntu kahambe engakhulumanga. Kulabanye abantu abalamadlozi, kulabanye abayefuna ukuthi ubani usitshela ukuthi amalembu angaphi, into ezinje singaphi. But a person with COVID does not have the chance sometimes ukulayela ukuthi isongo lemnguli lilapha, imali leyana iyathunyezwa ngubani bani bengiyichiye. So there will be a lot of unsolved issues, and there will be a lot of fights within the families. Because if umalume kumbe ubaba engaphonga ukuvuke efile, olunye lalo le family lufike luthola isithumba semali, liyazithathela luzithulise. So there are a lot of people are dying in family secrets.
Yes.
People are living problems. People are living things unsolved. And I think this is where I'm really challenging young people to be very responsible. Because abantu abadala abaningi and sengibazwile who have passed on, and the people say, but wayengahambi, wayengayindawo, wayetshona endlini. Yes, angabe etshona endlini, but there are other people who are going out. And when young people tell them what is a real COVID, most of the times they don't agree. So it is really a call to young people to act responsibly. Half the time abantu abasebenzi babefuna nje uyabhotapota town. But we are killing our elders. We are really carrying the virus to our homes because the virus does not move. It is us who are moving. My name is Zenzele, and this was the program Surviving COVID, where we are talking about the COVID pandemic and the many effects it is causing in our society. It is not just about sickness, it is not about death, but it has challenged our culture, our way of life, our religion. Because of COVID. So our faith is shaken. Now our beliefs are affected because of the COVID pandemic. Till we meet again in other programs, have a good day.